Hello, I'm Dr. Blair from Elixinol, and I want to talk to you about schizophrenia and cannabidiol. I'm going to go over a number of different aspects about schizophrenia and psychosis, and sometimes I'll use those words interchangeably. Schizophrenia is a big problem in this country, not only because of the people that we see, but by many of the people we don't see, the people who may be homeless, that are out of really conventional care. These people are invisible. They have an enormous amount of disease and problems. And in fact, this whole population, at one time there were huge institutions that were putting these people into hospitals and maintaining them, but that was many years ago. It was stopped, and these people essentially went into the community. Some of them were well cared for, but others were not. And as a result, we have many of these people that are in a dysfunctional state. We're going to talk about the conventional causes of schizophrenia, about endocannabinoid deficiency in this disease, just like other diseases. And I'm going to give you evidence for cannabidiol's benefits. We'll talk about some of the sizing and the management for these types of patients. Schizophrenia encompasses a number of basic symptoms. The first is psychosis, and this is a non-reality, whether it be auditory or hallucinogenic and visual. There's also these delusions of either persecution or that somebody is after you, the ideas that there's a connectivity that really are beyond belief. There's a sense of persecution among these people, and they're very, very cautious. There's also reduced emotion and very flat affect. They can't seem to express themselves appropriate, and they're very, very withdrawn socially. There's a number of other problems that are associated with schizophrenia, and that includes many of the autoimmune disorders as well. Irritable bowel syndromes is very, very common in this condition, and addiction to other substances occurs at the rate of on the order of about 30%. At least they're using addictive substances in that time. So there's a pattern, and you see these changes on the brain, as I've demonstrated in this PET scan, where there are dysfunctions that are showing up on different types of scans to show the activity that's going on within a normal person and a schizophrenic. The point that I want to make is that this is a physical problem. There are anatomical distortions and misconnections that are occurring. Now, what's the cause of that? That's somewhat debated. Schizophrenia affects about 2.5 million Americans. There's a lot of substance abuse that's associated with it, a broad range, and typically not any type of depressants, but there are a lot of stimulants that are being used. A huge amount of homelessness, and there's these major health problems that are involved, whether it's an autoimmune disease, irritable bowel, or anxiety depression, which is very, very common in this type of disorder. On the right is a CT scan showing the changes in the brain as a result of schizophrenia. And in this controlled study, comparing one twin with the other, you see the changes, the dysfunction that's going on in the brain, the anatomical changes that are revealed by some of the gaps in the spaces within the brain, as well as the decrease in the overall mass of the brain. This is just an example of some of the pathologic changes that are going along physically that are happening to the brain. And I point that out because this implies that there is additional causality related to schizophrenia, that it's not only a neurotransmitter type of problem, that it may relate to some more serious problems that happen in youth or even neonatal stress, where children are abused or have serious infections, and this is the result of those serious types of infections. There's also good evidence that there's quite a bit of inflammation that is going on within the brain. There's probably, and there is evidence for genetic defects that are occurring, but they do not encompass every single type of problem here. So that multiple causes, multiple reasons for why this condition develops. But I found it most intriguing that the concept that a traumatic event or an infection could lead to some of the chronic inflammatory changes that occur later in life. The current treatment, the conventional treatment that we have, are antipsychotic drugs, antidepressants, anti-anxiety, and supportive therapy. Now, these are all well and good, but they are not completely effective. And it's very difficult to make some of the patients take these drugs continuously because there can be enormous side effects associated with them. For instance, weight gain, there's breast development in men, there's lethargy and fatigue that's associated with it. There's a number of other conditions. There's movement disorders that happen with it if the dose gets out of range. So quite a few problems that are going on. There's also a supportive therapy that is there to help schizophrenics in terms of how they deal with their life situation, in terms of job skills, placement. A lot of energy goes into helping schizophrenics within our community that doesn't necessarily come up on the tab that the government pays, for the most part, for these types of problems. Because as adults, these people generally don't have any significant amount of health care or healthcare insurance. Well, current evidence is showing a significant dysfunction that's going on in the endocannabinoid system. And we're seeing that based on a decrease in the actual endocannabinoids, things like anandamide, as well as several of the other endocannabinoids that you may not have heard of. They're associated molecules, actually very closely associated with some of the omega-3 oils and how they benefit and they become endocannabinoids. These substances and these associated endocannabinoids are decreased in this disease, in this problem. But on the other hand, we're seeing increases in the cannabinoid type 1 receptor. So this all points to quite a bit of a difference. Those twin studies also found the same difference, where there were normal levels of endocannabinoids and receptors in the normal twin, whereas the twin with schizophrenia was showing quite a number of variations that were going on in this particular area. So this is an important area, and perhaps we can focus on an endocannabinoid treatment for this condition and stabilize it. In fact, we do have good evidence that a lot of the pathways of disease involved with this particular problem and the schizophrenia is related to the glial cells. Those are the supportive cells that are in the brain that are designed to take care of the hard work and deliver nutrients as well as protect the neurons from damage and injury. They also have a role to fight infection, and so they play a role in the permeability of the blood-brain barrier, as well as stimulating inflammatory cells and stimulating anti-inflammatory approaches. And the number of these cells, when they're activated, they can produce quite a bit of inflammation and problem if they're not working properly. They also stimulate an exotoxicity, where as a result of a release of glutamate, they can cause irritations and exacerbations of any type of a behavioral problem, as well as the function of the neurons. And the microglial cells, which are closely associated with this, are the actual inflammatory cells that protect the body inside the brain. Now, there were some very interesting studies recently that showed that the increased astrocyte activity, and an astrocyte is a type of glial cell, these particular cells, in the presence of cannabidiol, and in situations, improve situations of ischemia, Alzheimer's, and multiple sclerosis, and other neurodegenerative conditions, as well as schizophrenia. So all of these areas seem to be improved by the improvement of the glial cells and their function. Now, interestingly, cannabidiol has been shown to be cytotoxic to the glial tumors that may develop in rare cases. Glioblastoma is a well-known and a very serious, perhaps the most malignant of brain cancers. Cannabidiol is actually effective at destroying the glial cells. So it's quite an interesting contrast with abnormal cells. CBD is effective at destroying those and helping those go to apoptosis or self-destruction. On the other hand, it's supporting the glial cells, the helpful cells that are within the brain. The other thing that cannabidiol is doing is reducing the glial activation as well as the cytokine production. And I say modulation because specifically the cytokines are the inflammatory cytokines are typically increased in this disorder. And what cannabidiol is doing is reducing the inflammatory cytokines, but actually promoting the anti-inflammatory cytokines. So you're getting a double effect, as well as reducing those inflammatory cells, the glial cells that are there, the ones that are in that inflammatory role. It prevents cell damage. So the neurons who may be stressed as a result of the inflammation and perhaps some leakage of the blood-brain barrier are going to be protected against damage and destruction and going through the pathway of apoptosis and self-destructiveness. It's going to strengthen the endothelial cells. Those are the cells that are lining the blood vessels that are going through the brain and emboldening and making stronger the blood-brain barrier to prevent the leaky phenomena that can occur. If the brain is leaky, it will allow inflammatory substances in, as well as inflammatory cells that can further exacerbate the problem. Now, this is a classic study where cannabidiol was used in direct comparison with the best antipsychotic medication that was available. It was a 4-week study in 29 adults, and they were using 200 milligrams of each of these drugs or independently. So there was a group that were using 200 to 800 milligrams of the antipsychotic, and a group that were using 200 to 800 milligrams of CBD. At the end of the 4 weeks, which is a relatively short time, the results were the same. The CBD group had was as effective as the antipsychotic, the best known antipsychotic that at the time in 2012. So it was absolutely comparable. Head to head, both these substances were very effective in schizophrenia, and they were relatively equal. But the other part that is not so prominently mentioned is that there were no adverse effects with cannabidiol. There were none of the motor disturbances, the weight gain, or the sexual dysfunction that can occur. And there was no prolactin elevation. And I show that graph on the right where you show the difference between the baseline prolactin versus the peak level that was associated with the antipsychotic. So prolactin is the hormone that stimulates breast milk and breast development. And you can imagine that high levels of the prolactin are going to stimulate breast development, which would be very discouraging for men, that they would have this abnormality. That would be a good reason for them to want to quit their antipsychotics. So the huge advantage, and there are other health benefits are associated with the CBD as well, in terms of the anti-anxiety as well as the antidepressive effects. There are a number of studies. There's a great deal of evidence about the use of cannabidiol to improve the function of the brain and reduce the psychotic symptoms associated with schizophrenia. I've listed a number of these off about the astrocytes. We're looking at relieving the inflammation and the psychotic symptoms, as well as decreasing the THC-elicited positive psychotic symptoms that can occur. So we do know that if a susceptible individual is given THC, particularly in their youth, they could have a psychotic break. And this is commonly associated with skunk varieties of cannabis, but it can be elicited in any type of THC-derived product. Most of the time, this occurs with low CBD products, and they're high THC. A further definition and clarification of this actually found that there was a genetic defect in those people who were susceptible to THC as inducing psychotic symptoms. Well, in addition to the other studies, CBD was shown in numerous studies to induce an anxiolytic, the reduction as an anticonvulsant, antidepressant, antioxidant, and of course anti-inflammatory. And most of these things are occurring with multiple pathways. So it's not just one mechanism that's at play, and that means that cannabidiol has the potential of being much more effective in a number of these problems where there are variations in the disease type. Cannabidiol blocks the CB1 receptor. It also blocks the vanilloid receptors, which are also endocannabinoids related to inflammation. The GPR18 and the GPR55 are also related to inflammation and the stimulation of the brain for those inflammatory pathways. There's also modulation with the cannabinoid type 2 regulator and the receptor. And the result is an improvement overall. So the cannabinoid type 2 receptor is also very important in schizophrenia. It's waiting to be defined. Cannabidiol's main role appears to be as a blocker for the metabolism of the endocannabinoid system. And that way it lifts up the amount of endocannabinoids that are circulating to allow them to function, and it downregulates the number of receptors that are present. So it's leveling out quite a bit of the system that's in the endocannabinoid system. And it's stimulating all of this process along the way. So you're getting a recovery and a return to homeostasis as much as possible with the use of cannabidiol. So the CBD benefits schizophrenia in several different ways. Another way is with regard to drug addiction. We mentioned that earlier, that there's a very high rate of drug addiction, as much as 29% in young people with schizophrenia. Cannabidiol has the ability to block the tolerance of some of the drugs, some of the effects, so that they are not getting the pleasurable sensation, the high that they would get with that, as well as reducing any type of withdrawal symptoms that would be associated. Even substances like amphetamines that would normally be highly stimulatory, then cannabidiol can block much of that particular activity. So it has particular high benefit in reducing the types of problems that schizophrenics are encountering. As I mentioned before, it's the anxiety and the mood improvement, as well as working on the social and the emotional aspect, so that schizophrenics are able to express their emotion. They'll have more expression and social interaction with their peers, more dialogue instead of being withdrawn and isolating themselves. Furthermore, we're seeing cannabidiol, there's good evidence to show that it improves neuroplasticity. This is the ability to form new thoughts, to form new brain connections, to form new synapses, memories, and logic processes. And this is very important, not only for learning, but also for keeping down the brain inflammation that's going on. So the overall CBD effects on the brain, besides looking at just schizophrenia and psychosis, really relates to the neuroprotective and the neuroplasticity that it offers in all conditions, whether it's neurodegenerative diseases or these behavioral types of problems. It's modulating the cytokines as well as the neurotransmitters, regulating the intensity of those transmitters and keeping them under control. It's regulating the glial function, as we talked about earlier. And it's restoring the blood-brain barrier and the permeability barrier that should be there, preventing the leakage into the brain. It's modulating the mitochondrial energy to maintain the cell strength, and it's reducing the oxidative stress that's really associated with the inflammation that's going on in the brain. I have a picture of Vincent van Gogh with a bandage over his ear. He was schizophrenic, and a lot of his creativity came from that. After the resolution of his schizophrenia, he had much of his artistic skill was quite a bit diminished. We don't want to diminish those skills and those abilities, but we certainly want to relieve the suffering. How do you use it? How do you use cannabidiol in schizophrenia? Well, I like to start, and my recommendations are starting with 15 milligrams twice daily. And any form that is acceptable to the individual is adequate. Adjust it early and boldly to control the symptoms. Now, I suggest a target dose of about 30 to 60 milligrams. But you may need to watch them very closely to understand what's going on and support them very closely. Typically, a dose is about 4 weeks, and then you can go into a maintenance level where you may be able to decrease the dose based on their needs. These individuals have a great deal of needs, and they need quite a bit of support, so that providers need to be very closely dialed into their progress. There is a potential for some of these high-level antipsychotics to interact with CBD, although only high levels of CBD have been implicated in any drug interactions. Who should be using cannabidiol? If a psychotic, if a schizophrenic has symptoms that are really unresponsive to their therapy at the present time, they have compliance issues, they're not willing to maintain these particular drugs, or if they're having significant adverse effects from the medications, cannabidiol may be appropriate. And of course, if there's substance abuse involved, then cannabidiol may be able to reduce the intensity of that, reduce those cravings and those pleasurable situations and feelings that are associated with that drug abuse. Cannabidiol can also be used in those other things that may be associated, including irritable bowel syndrome, which many of these people also have. Let's go over some of the things that we've talked about in this presentation. There's a huge burden of schizophrenia, not just the number of people who are involved, but the homelessness and the suffering and the medical care costs that are actually associated with their other problems that they develop as a result of being withdrawn and afraid to enter facilities and to enter into care. That the endocannabinoid deficiency is very important in this disorder particularly. That CBD addresses all of the pathways to help people improve from psychosis and schizophrenia. And CBD is well supported in clinical studies as well as preclinical studies and practice. There's no significant adverse effects that are associated with CBD, no toxicity, and no significant drug interactions at low doses. So it was my pleasure to present this information to you, and I'd like to open it up to some questions now. I've put together a folder with some of the references that I've used with the documents, as well as I'll have the slides that I've presented here available for you for your review and for your ability to share. It's a pleasure being able to talk to you about it, and so that I look forward to talking with you next time. Now I'd like to answer some of the questions that you have, and I'll address those at the present time.